and give the virtual floor to Dorit. I'm very much looking forward to it. So please, Dorit, enlighten us.
Hi, everybody. So I'm saying hello from Houston, Texas. And I'll start by correcting the pronunciation of my name is Dorit Donoviel, and it's okay. Everybody slaughters it, so it's just fine. So I just want to tell you that I pretty much have the coolest job on the planet, I think. I get to work closely with NASA and scope out innovative health technologies on behalf of the space program. But because I'm not part of the government, but working in cooperation with them, I'm able to do partnerships with industry and foreign entities a little bit easier than having to do a lot of the paperwork. Our mission essentially with the Institute, it's TRISH for short, for Translational Research Institute for Space Health. We make grants. We make grants that are federal funds to universities and companies that are doing really kind of disruptive, cutting edge research that will in about 10 years time really make a difference for our capabilities to do healthcare in a tin can on the way to Mars. So let me paint a picture for you. You've got 3 of your colleagues that your boss picked out for you to spend 30 months together in a tin can on the way to Mars without any possibility of resupply or emergency egress. You're on your way, but for better or worse, you got to get along with these people. There may be geologists, there are scientists, maybe you're lucky and you have a physician on board, likely engineers, and you're going to have to do healthcare on yourself and your crewmates. With the ground, we have up to 20 minutes delay in communication at its worst. And there may be times when there's a loss of communication as well with mission control. So you have to be able to be autonomous. And while we send as healthy a people as possible, by the time folks are experienced enough in spaceflight to go to Mars on a mission like this, they're going to be middle-aged and they're going to have probably predisposition to certain genetic diseases, for example, cardiovascular disease or hypertension, et cetera. We're certainly going to send the most healthy people we can, but sometimes the space environment, the microgravity, the radiation environment, which we cannot shield against completely, can exacerbate or even create new medical conditions in these humans that are there for 30 months or so. So you're going to have to monitor your own health. You're going to have to take care of infections in space. We won't be able to send your lab work out to the clinic. There isn't one on the way. There's no Walgreens to pick up medicine. We have to send everything with you. The food that we send along, basically everything is packaged, so you're not going to get a lot of fresh foods. We're hoping to be able to grow some fresh foods, but there's not going to be a lot of real estate on board the spaceship, as you can imagine, and so we're not going to be able to grow a lot of fresh foods. So the concern is, you need healthy bacteria to keep your gut healthy. Your immune system may be compromised because of the radiation environment and just not eating the foods that you're used to here on Earth, et cetera. And so there's a variety of things that we need to worry about. So our institute basically scours the world and speaks to a lot of very smart folks who are innovating in healthcare. And what we envision essentially, and the value add for the companies and universities solving these problems is it's really not just a small market for space where really a handful of people will use these technologies. The whole idea is that if you can create capability that will allow you to do autonomous healthcare, you're basically making the healthcare more affordable and easier to use in the home. And we know with our healthcare issues here in the States, it's very expensive. Folks end up having to go to clinic or hospital. They can't get there often because of transportation issues if they're senior citizens and they don't drive. So if you can bring healthcare into the home, that actually solves a lot of problems for our healthcare here on Earth. So that's the model we're working towards. Should I talk about specific issues with regards to certain particular medical conditions? I don't know if I've gone too long or if
no, sure, you have a couple of minutes left. You could share a bit about some of the projects that you're working on that.
Sure.
Okay.
Sure. So we're really trying to be out of the box. And one area we're very interested in is the microbiome. So if folks don't know what that is, it's half the cells on your body or in your body are not your own. They're microorganisms. And it turns out that they're very important for our health. They can regulate your mood. They can regulate your immune function. They can certainly regulate how your tummy feels. And even they can regulate how you respond to medications. It's been quite a new area of research. So we're very interested in this area. And I think I've mentioned that in space, we're not going to have the variety of foods that we take for granted here on Earth. We're not going to have a kombucha that you can, drink, or a nice yogurt culture for you to drink every day. So we're looking at how to deliver the microbiome in new ways. For example, we have an investigator, Bob Langer at MIT, that's investigating an in-resident device that will sit inside your tummy, essentially, and will dissolve with time, that will slowly release good bacteria. So that's one possibility that we're looking at. Another is to personalize using some cells from your gut, which we can get, as you can imagine how we get that. It's very easy to do, but I'm not going to mention. And basically, we can culture and determine how your particular cells react to different microbes. And so we can personalize a probiotic treatment for you personally and for the astronauts who will go to space. So those are some of the things we're looking at. And then also in the future, we're going to be looking at the effects of manipulating the microbiome to the effects of, for example, radiation or confinement or other types of stressors.
Very cool. And so you're already working on insidables. Maybe, are you working already on some digital health solutions?
Yeah, so for example, one concern that we have is how folks will react to confinement, and behavioral health is actually something that we don't take for granted. A 30-month mission in a tin can is quite different than a year-long mission, even for our astronauts. And so some of the digital health solutions that we're looking at is tracking behavior and letting you know when you seem to be moving less, or you seem to have some stressors that indicate that you may be starting to go down a path that you may want to mitigate. So the other thing that has been developed is psychiatrists on a laptop. So we know that cognitive behavior therapy, when it's implemented by a software program, can be as effective as talking to a human therapist. And so with that, you can actually go through a diagnosis of yourself if you're stressed, if you have a conflict, if you're depressed, if you have anxiety, and apply an artificial intelligence-based cognitive behavior therapy on a laptop to yourself. And so it can be very private, and it appears to be quite effective in mitigating the problems.
All right. And then maybe finally, can you share us a bit about the funding you have available to give away?
Sure. So we have multiple ways to fund people. We do have to have, because it's U.S. federal funds, we have to have a U.S.-based entity, but we can partner with folks who are working internationally for goods and services. We can buy products from internationals as well. We have annual solicitations for large grants that can go all the way from $400,000 a year for 2 to 3 years up to $850,000 a year for program grants. We also have an industry program, which we partner with a consortium for innovations in, I always get the CIMMIT out of Mass General Hospital. They put out a call for us for companies in particular. We also have postdoctoral fellowships. We just released a solicitation yesterday, so check our website for postdocs. Our website is bcm.edu/space health, or if you just search space health, Baylor College of Medicine or BCM, you'll probably find us. And we also have a program where you can submit an idea for a proposal at any time, and all of those funding opportunities are online.
All right, thanks a lot. I think there's a lot of opportunity for both sectors, the space sector and the healthcare space, so to call it.
Right.
Thanks a lot, Dorit.
Sure, pleasure.